All right. Hi, my name's Anne-Marie. I'm a physician assistant student. I'm going to be taking care of you today. How are you? What's your name?
Ethan Fidelity.
And what's bringing you in today?
Kind of sensitive topic, I guess, but I haven't been able to keep an erection with my wife.
Okay. And how long has that been a problem?
About a few months now. We were hoping it would kind of just go away on its own. Tried a few things, but it doesn't really seem to improve.
Okay. What did you try?
I tried taking some just herbal supplements. Tried ginseng. And we thought maybe we would go to a counselor, but it really hasn't seemed to help at all.
Okay. And have you found anything else that did help? No.
Not really.
Okay. What about anything that you've noticed has made it worse?
Worse? No, it's really hard. It's not getting any better, and it's really causing a lot of stress.
I'm sorry to hear that. How have you been dealing with the stress?
I think we have a pretty good relationship, but it's just kind of hard when can't really get each other's needs met, I guess.
Okay. Has this ever happened before?
No, this was the first time that we've had any issues with it.
Okay. And do you have any pain?
No pain.
No pain. Okay. Any sort of discomfort, or just you can't get an erection?
I can't get one.
Okay.
I wouldn't say it's necessarily a discomfort.
Okay.
It's frustrating.
Right. Okay. And you said it started a few months ago. Has this been off and on, or has this been every time that you guys tried to have any sexual activity?
Most times. There's occasions where I can, but it's pretty few, far between, I would say.
Okay. How long have you been married with your wife?
Probably about 10, 15 years.
And what do you do?
You mean a job?
Yeah.
I'm a teacher.
Okay. Little kids or high school or?
I teach science in middle school.
Okay. Do you have any kids? Just going to grab something that I forgot. All right. So, any change in weight
No.
or fatigue?
No.
And what about fever?
I haven't had any now.
Have you noticed any problems going to the bathroom?
Not really. I mean, sometimes I get up at night to go to the bathroom.
Okay.
It's normally only once, I would say.
And has that changed since this issue started, or?
No.
Okay. And have you noticed any like increased frequency of urination?
I wouldn't say so.
Okay. What about difference in like amounts of urine that you're producing?
I don't think so.
And any burning or pain with urination?
No.
Okay. Any blood in your urine or urinary infections?
No.
Any like flank pain
No.
or history of kidney stones?
No.
And what about reduced stream or hesitancy?
No.
Have you ever had a hernia?
No.
I'm so sorry, I know there's a lot of questions.
Yeah.
And have you been having any discharge?
No.
What about any sores on your penis?
Nope.
Okay. And any testicular pain or swelling of your scrotum?
No.
Have you ever had an STI?
I did once while I was in college.
Do you remember what it was?
It was herpes.
Okay. And how did you treat that?
They just gave me antivirals. Whenever it pops up, I just take some.
Okay. Has that been bothering you in the past few months?
No, I haven't had any trouble with that for a while.
Okay. And no complications from that? And have you ever had HIV or been concerned about HIV? All right. And you said that you're sexually active with your wife. Are you sexually active with anyone else?
No.
And what kinds of sexual practices do you guys engage in?
Just sex. I mean, we've tried like oral, like stuff like that to like get me excited for sex. We occasionally like watch porn before, hoping that may help. But mostly it's just that.
Okay. And that isn't working?
No.
So, okay. All right. Like other symptoms that you notice that you've been having in addition to this, that kind of associated with it?
I mean, around maybe a little bit before it started happening, my doctor said I was getting like hypertension. Like it was in like wasn't like too bad yet.
And so you said that started like also a few months ago, right? Like right before this started?
That might have happened like a few months, like maybe like 5 or 6 before.
Okay. And what were you given any medication for hypertension, or they just told you that it was a little bit elevated?
They told me it was a little bit elevated. It wasn't in like the stage where I necessarily needed medication yet.
Okay.
They were gonna just watch it, I guess.
Okay. And have you like checked your blood pressure at home or had it checked since then?
I had it checked maybe like a month ago. They said it was about the same as what it was when I went in before.
Okay.
Around like high, like 130s, I think.
Okay. And have you ever had high blood pressure before?
No.
And I know you said that you were having some, like this was causing some stress in your relationship. So is there any other like causes of stress?
I mean, obviously kids at work can be stressful, but I mean, I like my job. I think we're still good. I mean, both of us show like some frustration a lot of times, but like our relationship is pretty good, I would say.
Okay. How's your wife handling it?
She gets frustrated at times. I mean, I try to do other things just to keep the marriage, keep her happy.
Right. Okay. Are you feeling nervous or tense?
No problems.
Okay. And any changes in your mood?
No.
Have you ever had a history of depression?
No.
Any changes in your memory?
No.
Okay. And you said you tried counseling, right?
Mm-hmm.
How was that?
We only went for probably like 3 or 4 times after it really wasn't seeming to help.
And what did you guys do at counseling?
I mean, we really just like talked about like maybe some like things that could be causing us stress, things to try like in the bedroom to make it work.
Or some of those suggestions, things that you mentioned that you tried before?
Yeah.
Okay. Okay. So, your doctor was concerned about some high blood pressure. Have you ever had any other heart problems?
I did have a heart attack a few years ago.
How old are you, by the way?
Oh, I'm 45.
Okay. All right, so you had a heart attack a few years ago. Okay.
That was probably like 5 years ago, maybe.
And what did they do for that? Or?
I mean, they did it. I get like some chest pain sometimes, but my nitroglycerin normally helps with it. But they said it was a minor one.
Okay. So sometimes you still have chest pain?
Sometimes, but not very often, I would say.
Okay. All right. Do you ever have heart murmurs?
No.
Or palpitations?
No.
What about shortness of breath?
Sometimes.
When does that seem to bother you?
If I go like exercise a lot, sometimes get shortness of breath, but I don't normally like get it if I'm just like around the house or something like that.
Okay. So by exercise a lot, like what is a lot for you?
I'd say like over like 30, 40 minutes.
Okay. And any like Swelling in your hands, feet, or ankles?
No.
And any trouble breathing at night when you're sleeping? All right. Any history of, or any medical problems?
I have diabetes too, but that's pretty controlled.
You take medication for that?
Yeah,
What do you take?
just insulin twice a day.
Do you know the dose?
I do not.
Okay. And you said you also take nitro occasionally?
Yeah.
And any other medications? Any other medical condition?
No, that's about it.
Alright, just to confirm, have you ever had hepatitis?
No.
And you did have a history of a heart attack, and then any COPD or asthma?
No.
What about cancer?
No.
Kidney disease?
No.
Or thyroid problems?
Nope.
And what about blood clots?
Nope.
Can you tell me a little bit about, well actually first, do you have any allergies?
No.
To like medications or food or insects? Nothing?
No.
Alright, can you tell me a little bit about your family history?
What do you want to know?
Like parents, health of your parents and grandparents, if you know anything about.
Yeah, my grandpa died when he was in his early 80s. He had lung cancer. My dad also has diabetes. My mom gets a lot of headaches. But she just takes like migraine pills when they happen.
Okay. How old are your parents?
I don't know, they're probably like early 70s.
And has anyone in your family ever had any problems with erectile dysfunction?
Not that I know of.
Okay.
I don't think we wouldn't talk about that.
Okay. Do you smoke at all?
Yeah.
How much do you smoke?
Probably a pack a day.
And how long have you done that?
That's been for about 15 or 20 years.
Have you ever thought about quitting?
No, not really.
Are you aware of some of like the health risks with smoking?
Yeah.
Okay. Not interested in quitting?
Yeah, I don't know. It's kind of like a stress reliever almost.
Okay.
At this point.
Yeah, well it sounds like you got some stress too, so that's understandable if you're not interested in trying to make another big change like that at the moment. But if you ever are interested in talking about quitting, let me know and we can discuss that and help you do that. What about alcohol? Do you drink?
Occasionally.
Okay, what's occasionally?
Maybe like 2 days a week, maybe.
Okay, and what type of alcohol do you drink usually?
Normally just beer.
And how much would you say you have on a typical day?
2 or 3, maybe.
Okay. And do you use any drugs?
No.
Okay, such as marijuana, cocaine.
Mm-hmm.
What about, do you ever use any, like family members' prescriptions that maybe aren't prescribed to you that are kind of left over?
No.
Did you have any illnesses as a child?
Not really.
Okay. What are specifically measles, mumps, or rubella?
Mm-mm.
Okay. What about chickenpox?
Nope.
Did you get the vaccine for chickenpox?
Yeah.
And then, do you ever have rheumatic fever or scarlet fever? Any history of psychiatric disorders?
No.
Do you happen to have did you have all of your childhood immunizations?
I think so.
Okay.
Parents pretty much immunize me for those things, so I assume.
Okay. Do you know if you got a tetanus shot?
Yeah, I still get boosters for that, so.
And what about Hep B?
I think I have it.
Right. And did you get your flu shot?
No, I don't normally get that one.
Okay. And have you got the shingles vaccine?
No.
Okay. And all right. Have you ever had any accidents or injuries?
No.
And with your diabetes, have you had any complications since you've been diagnosed and started treatment for that?
I mean, there's times when, like, maybe I'll, like, miss a meal or something, and I maybe get, like, a little bit, like, lightheaded, but that's normally, I just eat some, like, hard candy or get, like, a snack or something, and it pretty much goes away.
Okay. All right. Have you ever been hospitalized?
Just for the heart attack.
Okay. And you said that was about 5 years ago, right?
Yeah.
And what hospital did you go to?
I went to RA Torresdale.
Okay. And they gave you nitro, you said, right? They prescribed that for you. Okay. And do you have to have any procedures done while you were there?
They did something. I don't know what they did.
And were there any complications?
No.
Any other hospitalizations?
No, that's the only one.
Okay. And what about any surgeries?
No, I've never really had surgery. I mean, I had my wisdom teeth out when I was in high school. I also got my tonsils out when I was in high school, but pretty much it.
Were there any complications from either of those?
No.
Right. Let's see. Do you know the last time that you had a TB test?
I don't think I've ever had one of those.
Okay. What about, have you ever had a colonoscopy?
Yeah.
Okay. And what was the result of that?
They said they were fine.
Okay. Do you remember when you had that?
Probably maybe 4 or 5 years ago.
And when was your last prostate or testicular exam?
I get those about every year.
And when was your last one? Has it been like closer to a year, or was it in the past month or so?
I should be coming up
Okay.
soon, like in a few months.
Okay. And was that normal at the last exam?
Yeah.
Okay. And when was your last cholesterol test?
They normally take that when I'm at my yearly prostate primary visit.
And do you remember results of your last one?
They didn't really say they were high or anything.
Okay. And have you ever had a fecal occult blood test? And have you ever had a lung cancer screening?
Yeah, I get those when I go to yearly, every so years,
Okay. And do you know what your results were from that?
They said they were alright. Since I'm a smoker, they like me to keep getting.
Right. Okay. So I know you said I want to ask you a little bit more about your family and history. You said your mom had a history of headaches. Any seizures in the family? Okay. What about history of stroke or mental illness?
No.
Suicide?
No.
Substance abuse?
No.
Any history of thyroid disease? Heart disease or hypertension? Yes to diabetes. Your dad, correct?
Yep.
Okay. Hyperlipidemia?
No.
And what about any history of asthma or tuberculosis?
My aunt had it.
Asthma?
Just asthma, yeah.